Hey everyone, this is Dr. Tony Miller, and this is a short presentation on why some kids get chronic ear infections and why some kids do not get chronic ear infections. And so, really, where this presentation begins is with this: ear infections, although they're very common in our children, they are not normal. So, the question is, why does my child keep on getting ear infections? Why have we tried countless rounds of antibiotics and tube surgeries and nothing seems to be working? It's not because your kid is walking through a cloud of bacteria every single day. It's because fluid is accumulating in their ear, and what that does is that inflames the tissue, and that causes stagnant fluid. And that becomes the perfect environment for a virus or a bacteria to set up shop. But why isn't their ear draining that fluid? Because when you take a bite of food, it doesn't just drop into your stomach because of gravity. You have a muscle called the esophagus, and that milks that food down, and that's why you can swallow even if you're standing on your head. And the same process occurs in your child's ear because there's a muscle called the tensor valli palatini that is the key to all this, and its job is to milk the fluid out of your ear so it can drain down through the eustachian tube and into your throat. In a kid that gets chronic ear infections, that tensor valli palatini muscle, it becomes spasm and it doesn't let the fluid drain down the eustachian tube like it needs to. So why would that muscle become spasm? Well, 9 times out of 10, we can trace it back to the birth process. And that tensor valli palatini muscle gets its nerve supply from the top part of your neck, which is the most vulnerable part of a baby during the birth process, especially if there was forceps involved, if there was a vacuum extraction, or even a C-section delivery where there's a tremendous amount of pressure on that child's neck. Because that nerve supply to the tensor valli palatini, if it becomes irritated, if there's interference, it stops working. And that's when the fluid doesn't drain and that child gets that ear infection. So do antibiotics help with this? No. And does drilling a hole through the ear seem like the best solution? No, not really. And that's why the American Academy of Pediatric and countless medical research articles has said for decades not to give antibiotics to kids with ear infections, because not only do they not help, but they significantly increase the risk for getting a future ear infection, as well as asthma, as well as allergies. In fact, the best advice that they can give is to just wait and see what happens and to do nothing at all. But if you're a parent and this is a concern and you have a child that has had multiple ear infections, multiple rounds of antibiotics, multiple tube surgeries, you want to know what you can do about it. Well, the number one thing is to get the tensor valli palatini muscle working again, and that's where chiropractic care comes in. With a very gentle and specific adjustment, we can remove the interference to the nerves that supply the tensor valli palatini muscle, and that's when the ears begin to drain that fluid through the eustachian tube, and that's when the child's body starts to begin to work normally. And we get to see this every single day in our pediatric chiropractic offices across the country. So how do you know if this is what's causing the ear infections? How do you know if my child has nerve interference that is causing that muscle to spasm? Many pediatric chiropractors will use a very specific nerve system scan that determines where that problem is, what is causing the ear infections. And it's the same technology used on astronauts to see if they are healthy and safe enough to be in space. And so it is completely non-invasive, it's painless, there is no radiation, and the most important thing is there's no guessing. The scans show a very clear output on the screen, and you can see it and we can see it, and that's what we go over and explain in detail what is causing the ear infections. Why is this problem always there? And this right here is one of those scans. And so this is what a scan would look like for a child that has ear infections. So the big red bars that you see at the very top, that's not good. That shows that there's nerve interference to the ears and to the nose and to the throat area of this child. And so after removing that interference to this child's nervous system with very specific and gentle adjustments, it looks like this. So it's nice and clear, and now this kiddo is healthy. So this little guy's name is Sammy, and he was 2 years old when he started care. And his history was he had chronic ear infections all of his life. He always had fluid in his ears, and he failed every single one of his hearing tests, and he couldn't speak. And his parents had tried antibiotics, multiple rounds of antibiotics, and were now considering tube surgery for him. So after starting care and removing the interference to his nervous system, allowing his body to function normally, he went back to his pediatrician, and the pediatrician said that there's no more fluid in his ears and that he was able to pass his hearing test for the first time in his life, and he's actually beginning to learn how to speak, which is absolutely huge for him because this has completely changed his life because he no longer has interference to his nervous system, and he's now able to function and be healthy like his parents had hoped without the antibiotics, without the surgery. So wouldn't it be great if this could be your child, if your child could have this success? Well, they can. And if you have concerns about your child having a weakened immune system with the ear infections, the allergies, the asthma, the first step is to find a pediatric chiropractor. And we're located in Downingtown, Pennsylvania, but we have helped parents from all across the world finding a pediatric chiropractor for them, and we'd be happy to do that for you. If you're listening to this presentation and you are wondering if this is what is causing my child's ear infection, is this why my child is always sick, why they have chronic colds, why they suffer from allergies, why they suffer from asthma, we absolutely can help them. And we believe that you guys deserve the opportunity to find out how. Contact our office so we can set up a time for you to go over these scans to see what is causing your child to get sick, have these reoccurring ear infections. Again, if you need any help finding a pediatric chiropractor in your area, just reach out to us and we'd be happy to help. Thank you guys so much for listening to this, and have a great day.